Good afternoon, everyone. I'm here to talk to you, the administration of ABC Medical, about the concept of evidence-based sex and gender medicine and how it's impacted by fundamental differences of biology and behavioral differences between men and women. Men and women, as we know, are alike in many ways. However, there's some important biological and behavioral differences between the two genders. Those differences are going to affect the way we treat many widespread diseases from a healthcare perspective. Despite the knowledge of the crucial differences between men and women, there's not a whole lot of providers out there providing gender-specific healthcare at this point. So we want to be one of the first to get out there and start moving in this direction. The prevention, management, and therapeutic treatment of many common diseases does not reflect the most obvious and most important risk factors in my mind for the patient, which is going to be sex and gender. So to discuss and address properly the healthcare differences between men and women, it's going to be necessary to distinguish between sex and gender and their respective effects on people's health and healthcare. Sex differences are based on biological factors, which are going to include reproductive function, concentrations of sexual hormones, the expression of genes, and actually chromosomes. Gender, on the other hand, is going to be associated with behavior, lifestyle, and life experience. It's going to determine the access of healthcare, the use of healthcare systems, and the behavioral attitudes of the medical personnel which are involved in their care. Typical gender differences in healthcare are going to include differences in the use of preventative measures, prescription drugs, health insurance reimbursement, and referral or acceptance to particular medical care therapies out there. Sex influences health by modifying behavior. Testosterone, for example, is going to cause more aggressive behavior in males, especially young males, just because that testosterone level is higher. They are going to be out there seeking more risk and possibly neglecting their personal health. On the other hand, gender behavior can modify biological factors and thereby health. Exposure to stress, environmental toxins, poor nutrition, or lifestyle choices can result in changes to the care plan. These modifications will be different for men and women because the DNA repair and other mechanisms are modified by different sex hormones. Gender medicine aims to include biological and cultural dimensions and their effects on men and women to improve health and healthcare in general. One of the populations that we need to mention and discuss is going to be our transgender community. We really need to be sensitive to this group of folks. They have a very specific issue that they're dealing with. They actually are identifying with one gender when their biological sex is different. So it's going to definitely pose some challenges to the healthcare professionals who have to take care of them. So we're going to have to provide plenty of training, sensitivity training, and then training on how we treat these patients and conversate with them so that we can get a better background so we can treat these patients in a better way. As discussed earlier, sexual and biological factors play a major role in how the patient should be treated from a medical standpoint. So for example, with cardiovascular disease, there are definite differences between men and women and how the disease presents itself, as well as how it should be treated. And we just know this from years and years of study, and just knowing that we have to deal with these diseases and the consequences in very different manners based on sex. A lot of that has to do with hormones and genes, as we talked about earlier. In this case, with transgender patient populations, like I mentioned, we're going to have plenty of training going on, make sure that our folks are being sensitive to this patient population. And we want to make sure that we are identifying them so that they can receive the best best practices that are associated with their biological sex. So we want to really be taking care of people of all sexes, no matter who they're identifying with at the time. So if there's a lack of gender-based medicine, prevention, management, and therapy can negatively impact the care for both male and female patients. So we can no longer just sit back and take the one-size-fits-all approach. We as a healthcare organization need to embrace new approaches to gender-based care. We need to train our medical staff. We need to tailor clinical procedures, alter therapies, and push to have gender-based drugs developed. All these things are going to be very important. And by not having gender-specific health care, we're missing out on more efficient and effective care for our patients, for both men and women. And from a cost benefit perspective, adequate and appropriate care is going to lead to more money in the long run. I mean, if we have more adequate and appropriate care, we're not going to be spending money on care of men and women that is just not doing what it should be. So we want to definitely focus on these aspects. We want to start moving in the direction of gender-based medicine, and we really hope that you and your teams embrace it and start moving in that direction. If anybody has any questions, feel free to give me a call at any time. I'd love to come by and just talk to you more about gender-based medicine and what we can do to make it work here in our facility. Thank you everybody for your time, and have a great day.